Hi, I'm Sarah Mitchell Chen.
And I'm Dr. Jory Fleischer.
We want to welcome you to Rush Recaps, a short educational series of videos that help address some of the most frequently asked questions we hear from patients, families, and care partners here in the clinic. This series is made possible by a grant from the Parkinson's Foundation to help incorporate palliative care into team-based care here in the clinic. And so today, Dr. Fleischer, we often get questions from patients or their family or care partners that sound something like, I'm losing weight and I'm not trying. What can I do, or should I be concerned?
It's such a great question. And I think there's a couple of things to think about when this is the case. So, number one, knowing that this is a really common concern and question that comes up. And we can see people losing weight unintentionally early in a diagnosis or even before they're diagnosed with Parkinson's or related disorder. And we can see it at any point throughout the disease course, and particularly in later stage disease or towards the end of life, we often see significant unintentional weight loss. So the important first thing is, even though all of these videos and all of us are very focused on Parkinson's and related conditions, just because you have one of those diagnoses does not mean that you can't have something else. So when someone tells me, or when I notice that they're coming in and their clothes are fitting really loosely, the first thing that I think when I see someone with unintentional weight loss is, are you up to date on all of your age appropriate routine cancer screenings? Have you seen your primary care doctor? Is there something else that could be going on that could be treatable and that could explain this, right? We don't want to lump everything under the umbrella of Parkinson's or Lewy body and say, this is why this is happening, and miss something that's also really important and separate, right? So have you gotten your mammograms? Have you gotten your colonoscopies? Has your prostate been checked? Have you had all of those routine things? If those have not been checked, they should be. Talk to your primary care physician. If those have been checked and are normal and you're up to date on everything, then I think we have a couple of questions that we really want to focus on. So one thing to know and one thing that we want to ask is, has your sense of smell, has your sense of taste changed? We know that this is actually a really common issue for people with Parkinson's and related conditions. And actually, it may seem like, no, I don't really notice a difference. But this is not something that changes overnight. Okay. Loss of sense of smell and taste was a Parkinson's thing way before it was a COVID thing. All right. So that can happen quickly. This happens gradually over time. And so gradually that people might not notice that it's happened. But think about, can you smell if something is burning on the stove? Do you notice it, or someone has to tell you that that happened, right? Or it's springtime now as we're recording this. If you're going on a walk, are you smelling all the flowers? Are you smelling all the things that are giving you allergies or not, right? And maybe you didn't ever used to, but maybe you did. And so loss of sense of smell and sense of taste can lead to people just not having as much interest in food or the foods that they used to love the way that they did before. And that itself can lead to weight loss. Sometimes eating becomes so slow because just manipulating a fork and a spoon or getting the food to your mouth is slower than it used to be. And your stomach sends messages to your brain to tell you that you're full after about 20 minutes. So if you used to be someone who just kind of shoveled everything in, you might eat a massive plate of food by the time that 20 minutes has elapsed and your brain says, yeah, okay, enough. But now you might eat a quarter of that amount over that same amount of time. And your brain goes, nope, we're full. And so you might feel like you're eating the same amount. The plate might start off looking the same, but you're only eating a smaller amount because of slowness of movement, or if there's any issues with chewing or swallowing. So let's take the chewing. People can often have accelerated tooth decay and cavities related to Parkinson's and related disorders. We think this is actually the disease itself causing dry mouth and excess saliva, and they don't balance out. They kind of pile on top of each other and make you more likely to have dental problems and tooth loss. So if it hurts to chew, if it's uncomfortable, if you've lost teeth and it makes it harder to chew other things, you may restrict your diet and restrict your caloric intake and lose weight that way. Also, swallowing changes are really common in people with these conditions and can lead to people restricting their intake as well. So they're taking in different foods, less food, fewer calories, which all leads to weight loss. And I think a really important thing to know about that is this is not the weight loss that the rest of us want. This is an unhealthy kind of weight loss. This is losing muscle mass, which means that if you are to fall or lose your balance, there's less ability to catch yourself. There's less cushion if you fall on your hip to prevent you from breaking a hip or fracturing another bone. So this isn't a good weight loss when it's unintentional. This is a weight loss we want to recognize and we want to stabilize and turn around if we can.
And so kind of piggybacking on that, what if someone is noticing they're having some unintentional weight loss? What can they do, or who should they talk to?
So I think one of the unsung heroes in the healthcare field are our dietitians. These are trained professionals with a wealth of knowledge. And I will be honest that when I hear the term dietitian, I often think that this is someone who will help my patient follow a diabetic diet or help someone who's trying to lose weight, right? They're coming in hot with the kale smoothies, okay? And they can, right? And they can be great for those things. However, our dietitians are also brilliant at helping find ways within the foods that you enjoy, within what is doable for you or the people who are cooking for you, within your culture. How can we sneak in extra calories, extra nutrition in a way that is tolerable and I might even say enjoyable, right? To prevent that further weight loss, to gain the weight back if we can, right? This is not saying everyone should do the following. You all have to do the following, right? Not everyone should go out and get a nutritional shake and pound one of those all the time. That might work for some people, right? Something like a booster and ensure or something like that. But that's not the answer for everyone. And even for someone who likes it, that might work for a little bit and then they kind of get sick of it. So we need other suggestions. Our dietitians often are really great at finding ways, recognizing that we might need to change the texture of foods. So maybe stuff needs to be pureed. Maybe it needs to be soft or chopped in a different way. They can help us figure that out and give you ways so that's palatable and not like, ugh, we don't want hospital food. We want your food that you enjoy in a way that you enjoy it and in a way that's safe and you can get that nutrition in. It might be something as simple as when you're having pasta, for example, your serving gets an extra drizzle of olive oil on top of it, or your mashed potatoes get some extra heavy cream stirred in, right? It's the food that you're eating, finding a way to fortify it with some extra calories. And often we hear that, well, my loved one with Parkinson's might need more calories, but I, as the care partner, am on a restricted diet. So I can't do that. I can't cook separate meals. That's not what anyone wants you to do. We want you to cook the meal that you enjoy, that your loved one enjoys. And you may separate out the portions and doctor them each a little bit differently, right? There are ways to work this into your life, not work your life around this. So
The other quick fire question I might have is, you mentioned sometimes swallowing can change. If someone is noticing or wondering if their swallowing is changing, what can they do, or how can they learn more?
So they should definitely mention it to their provider, to their neurologist. We can send you to our wonderful colleagues, our speech and language pathologists or speech therapists. There are swallowing studies that can be done. And you may have had experience being in the hospital and someone says, I'm going to do a swallow test. And they bring you a little Dixie cup of water and they watch you swallow and go, that looks good. Okay. We mean something a little bit more involved than that. So this is typically going to an outpatient area of a hospital and having a formal swallowing study. So they may watch you, they may even video or x-ray you swallowing different consistencies of foods and liquids to determine what's safe, what's not safe right now, recommend swallowing therapy to help you get stronger and improve the things that you can tolerate, and also make recommendations about, given our limitations right now, here's what we would suggest that you eat or don't eat.
Very, very helpful. Thank you.
Yeah.
We hope that this continues to help address some of those common questions we get. If things come up for you as you watch this video, please write them down, bring them to your next appointment with your provider, send this to your family or friends if they have been noticing or have asked you about things. Please feel free to share this and explore the other videos that are part of this RUSH recap series, as well as the other educational videos on the movement disorder patient education page. Thank you so much for joining us today, and we will stay tuned for future episodes.
Take care.
Take care.